Hi, it's David Green, founder and CEO of R3 Stem Cell, the nation's leader in regenerative cell therapies. We used to think years ago that a total knee replacement was an incredible improvement in somebody's quality of life. In fact, it was named by lots of publications back in the early 2000s as one of the top 5 quality of life improving surgical procedures. But a recent study in the British Medical Journal, looking at thousands of patient outcomes, showed that in most individuals, the improvement in quality of life after a knee replacement was absolutely minimal. And then another study came out in the last few years showing that up to a third, 33% of patients are not happy a year after a total knee replacement with their outcome. So what does all that mean? People really should look at it as a last resort procedure, because anybody who has a knee replacement before the age of 65 has a very high likelihood that he or she will need a revision procedure. So what are those non-operative procedure options that you can consider before the end game, which would be the knee replacement? Well, we know about the usual ones: anti-inflammatories, steroid injections, hyaluronic acid type procedures, Synvisc and Suparts. But it's a good idea to look at a regenerative cell therapy. And what that could include is things like exosomes, secretomes, growth factors, microRNA, stem cells, all the things that are in the biologics that our centers in our network use. So if you visit us online at r3stemcell.com, there's a lot of educational information there, and then call us at 844-GET-STEM. We'd be happy to get you in for a free consultation nationwide at any one of our centers of excellence. Thank you.